Thank you for staying with NTV Today. My name is Gladys Gashanje. Definitely a lot happening today, and we'll be bringing you up to speed as soon as we can reach some of our reporters who are on the ground bringing us current affairs from different parts of the country. But in studio now, having that conversation on World Food Safety Day. Now, here's the thing. Today is actually the first ever World Food Safety Day adopted by the United Nations General Assembly in December 2018, and it's being celebrated today, again, as I said, the 7th of June 2019. Under the theme Food Safety, Everyone's Business. Now, to help us understand what this is about and how it actually applies to us as a country, with me in studio, I've got Henning. You said I should call you Henning who? Nyaga. Well, he has a very hard name, but yes, he is from the Royal Danish Embassy, Dunedin. Thank you for joining us. Next to him is Dr. Alan Azagere, who is a directorate from the Directorate of Veterinary Services. We have Dr. Mercy Lungaho, and she is from the Food and Agriculture Organization. She is a representative from there. And of course, Dr. Andrew Edewa, who is from UNIDO, United Nations Industrial Development Organization. Thank you for joining me. Now, let's start with the fact that this is the first ever World Food Safety Day. What does that mean for us as a country, but most importantly, universally? Henning?
I think it's important to create awareness of the importance of food safety worldwide, and maybe both put consumers and put businesses and put the public sector together and work on common issues to understand how we improve food safety.
Okay, Dr. Lungaho, for us as a country, how important is this day?
For me as a nutritionist, I look at food as a starting point for energy, our well-being, and general happiness. We often take food safety for granted, and today we're bringing food safety to the spotlight and asking the question, how can everybody, all of us, take the responsibility to prevent, to detect, and even manage foodborne risks? As a country, we often talk about food security, but there's no food security without food safety. So as FAO, we're really pushing this day, and we're happy to bring awareness to food safety.
And for you, Dr. Andrew, how important is this day?
Yeah, this is a very important day for all actors that produce food. Food business operators, they're involved in one way or another in producing and supplying food. It is your responsibility to make sure that the food that you produce and supply is safe. Yes.
And Alan?
Yeah, as a country, this is one of the greatest achievements we've managed to get to, because this is a day that we have lobbied to have. And we are proud to be part of the League of Nations who championed this process through the Codex Alimentarius Commission, which was the one which proposed the adoption of this day to the United Nations. And we are happy that it came to fruition during my time.
Okay, and definitely this is a first of very many to come.
Very many.
Okay.
It will be a standard a date that will be celebrated annually. Yeah.
Okay.
Going
now,
forward.
let's get into the nitty-gritties of it. I mean, from the Kenyan context, we have dealt with so many issues in as far as food safety is concerned. The biggest, I think, every Kenyan can attest to is aflatoxin. You know, we've had about the maize, we've had about some of it in peanut butter just a few weeks back. And the question is, how is it that we've gotten to a point where food is being contaminated so often than it was before? Dr. Lungaho.
That's an interesting question, but I think it's not that food is being contaminated more often. I think it's because we're more aware. And I love what the media has done to bring awareness towards food safety, to run those stories. What I see as FAO, we have looked at the problem and brought about tools that can help to rapidly test for aflatoxin. So the fact that we have technologies to test for it, we have platforms to talk about it, we hear it more frequently, and that's why we're bringing awareness to the consumer, to say, as a consumer, when I walk into a portion mill or I go to buy grain, I should ask the person selling it to me, has this been tested for aflatoxin? Do you know how much is in it? Because if I take responsibility as a consumer, then the entire food chain will become more responsible towards communicating to me the safety of my food and ensuring that my food is safe.
Now, Dr. Andrew, you're Kenyan. We've been through this a long time, and she's saying we're more aware now. That's why we're talking about it. Are we saying we're coming from a point where we probably were consuming without knowing what's going on, and maybe even now paying for it health-wise for a long time?
Yes, it is true, because now is when you are beginning to see the real effects of food safety, because some happen after a long time of exposure. Some are very instant, like you fall sick after eating unsafe food. But others will take some time, and it could lead to increased cases of cancer and those kind of things. But given that as a country now we have diagnostic technologies to be able to find out exactly what the problem is, then you realize that now we begin to see this more and more. However, our food, the food supplies, whether it is from plants, whether it's from animals, our food always has the risk of something unsafe in it. And food is not food if it is carrying something that's unsafe. And this is the awareness that we need to create and have everyone responsible for the production and supply of the food address those issues wherever the food is being produced or supplied. Yes.
All right. And Dr. Allen, speaking of the production of it and the supply of the same, clearly you will find in some cases where the producer will say when it left me it was fine, but by the time it was getting to its destination, something was wrong, which was the case with the peanut butter case. At what point do now those in, in charge ensure that all the processes are kept in check to ensure by the time it's coming to my table, it's still safe for Kenya?
Yeah, every food business operator has responsibility to ensure the food that he produces is safe for consumption. And as government, we have put in place various laws that govern the activities within the food chain. So at production of the peanuts, as you say, the farmer is actually a food business operator producing peanuts, which should be well handled and stored, because the storage conditions have an influence on the aflatoxin development through the molding. Now, thereafter, as he hands it over to the processor has to play his part and first be able to check, is it free of aflatoxins or molding? Is it kept well? And if I process it into peanut butter, am I sure that there is no contamination or any presence of aflatoxins in it? Now, when he releases it to the supply chain that reaches the consumer, whoever will handle that transport and storage, all the conditions around that and any damage to the packaging that could have occurred during that period, it's the responsibility of that trader to see to it that it's done well. So everybody within that chain, if you check, and at each stage, the laws that we have in place have clear guidelines on what you should achieve as a trader. So if you violate, that's when we come in and enforce the law and the penalties that follow. And that is not geared towards punishing the trader only, is to make sure you protect the consumer from harm. So the law is not designed only to punish any wrongdoers, but also to protect you from that harm.
Okay.
Yes.
So at this point, the question would be, we have found products on our shelves that have the rubber stamp of the Kenya Bureau of Standards, and because of that I will pick it up and say it's safe for me. Then you get home, you open, and clearly what's inside is not good for you. At what point then have we been dropping the ball? Because the conversations have been there, and we have instances where the system seemed to have been bypassed, or what are we missing here?
It's more or less the regulator takes samples and verifies. So whatever sample you verify from production and the batch taken periodically, it's not a continuous, or you don't test everything. So once in a while you may find something on the shelf, probably with the mark, but I wouldn't say that all the products that have that mark of quality from Kenya Bureau of Standards may be safe, because the parameters the Kenya Bureau of Standards may be looking at may be different, specifically based on the declaration of the manufacturer. Now, when it comes to, say, Ministry of Health or Agriculture or other institutions, they are very specific with what they have to do in the same chain. So at the end product, Ministry of Health has a very significant role in the environment of that food and what is in that. So when it's off, the responsibility is with the Ministry of Health to take action. But it's not possible to test every product that comes. So whenever it occurs, it's important for the consumer to report to either the Kenya Bureau of Standards and the Ministry of Health that I found this, and also the company, so that a traceback mechanism is put in place.
Okay, for you, Henning, definitely you come in as a partner in this, and just listening to how the system works in the country. How do we ensure that now, Kenya being one of the member states that's actually putting this in place and is very aggressive about it, that they take responsibility for each stage and to ensure that that consumer is protected?
Yes, the Danish government, both the Minister of Foreign Affairs and our Veterinary and Food Administration have worked very close with the Kenyan government for the last 3 years on a food safety program we call the Strategic Sector Collaboration Program on food safety. And I very much agree with Alan on the turnaround, the need for a turnaround on the food control system in Kenya. And there has been a lot of initiatives going on for the last couple of years, and I think it's a very significant point to make that the food business operators in the whole chain need to know their own risk, because food is being consumed all the time, and the flow is so big you cannot control every single product finally produced, and it will, even if you detect some pollution, contamination, it's gone, and the traceability is maybe not that tight in the chain. So the system that we work with in Europe, that we try to share knowledge about, is to have a quality system where all the competent authorities in Kenya, which are many, that have mandates and sometimes overlapping mandates, that they work very well together to harmonize and know what each part is doing, and to make a turnaround in the food control system, putting the responsibility back to the food business operator, which is also said here. And I think that process is going on right now. It's a very good development for Kenya. Of course, there's still many challenges, but that's very natural. And we have been through, in Denmark, we have been through a lot of challenges too. And we are very happy that we have a nice and good collaboration, and we can share our experiences on this work. I would say on the consumer awareness, of course it's very important that the public sector also play a role to share information. But it's also a role of the private companies that they share information on labeling and so on, what is actually in the food and what is a potential risk. And that is a system that the public sector should set up. So to make that feedback and that control system. We work on a multi-annual national control plan in Kenya right now. It's been a process for some time, but that is definitely the way to go.
Okay. Now, Dr. Lungaho, you're very passionate about nutrition, and Kenya has been grappling with foodborne diseases. We're talking about the outbreak of cholera especially, and this seems to be recurrent because we are not only now dealing with the food safety, we're talking about sanitation, proper sanitation, lack of it. We're talking about lack of enough water, which is also very important in the handling of all these products we're talking about. How important is it to reel in other stakeholders to ensure that we keep up the quality assurance, so to speak?
I love that question because it emphasizes the theme of this year's World Food Day. It's everybody's responsibility. Unfortunately, sometimes we work in silos. As consumers, we don't know who our go-to person is. As researchers, we don't talk well to consumers. So I think we need a platform, and FAO provides that platform to bring stakeholders together to talk about how to mitigate foodborne diseases, how to act in an emergency setting. FAO has a very powerful partnership with the World Health Organization, WHO, and WHO works at the consumer end. When there's an outbreak, they come in to mitigate. But we need to all work together, like everyone has said on the panel. And I'm challenging the media to set up platforms where we can more often talk about emerging issues and issues that we have long struggled with, because we need those platforms now to address food safety.
Okay, Dr. Andrew, let's talk about, when you talk about cholera and all that, people in the Kenyan setting will be thinking vibanda. You know, that's where we go wrong. But the truth of the matter, we have also reported that high-end restaurants have had an outbreak of the same. So what are we missing out on, and what should be tightened on our end?
Indeed, you are right. That is not just the vibanda where we have got food safety concerns. You had even higher-end hotels, people eating and falling sick. This is a concern then that where do I go and eat? Which confidence? Where do I go? Our tourists, when they come, how safe are they? And you can see the economic importance of food safety in this sense. While on the other hand, we're looking at the health aspects of food, about the burden of disease that comes from cholera and other outbreaks. The economic impact is really high. So as UNIDO, which is the UN Industrial Development Organization, we look at first the business sector, trying to say exactly that they have in place systems that can ensure that when food is produced, then it is processed or manufactured and packaged and then supplied in a manner that ensures that there is no possibility, or we minimize the possibility of contamination as the food then moves to the next stage and the next one and the next one. Now, where have we gone wrong as a country? I think that, as my colleagues have said, there needs to be a more coordinated approach. First, we should know that food production and supply is not a one-person's business. It entails the interconnectedness of businesses and actors along that chain from the time you produce all the way up to the time it's consumed on the table. And in each of those steps, something is likely to go wrong. Either there are dirty personnel handling food, or the environment which you are producing that food itself is contaminated and it's very bad, or you are using water that is dirty and cannot meet those conditions of producing food, or you have got pests running around, cockroaches or rats everywhere, and we then contaminate the food. All those factors. And this is what at every stage we need to examine and see that controls are put in place. So as UNIDO, we help the business sector first in understanding the standards which standards need to be put in place, should be met, in order that when food is produced and supplied, that it does not fail at the next stage. And these standards then have got to be acquired from national standards bodies, who also in turn acquire this from Codex, which is the international body that is with standards under the FAO and WHO framework. So the standards then come. So again, you need to therefore have a responsibility then to work with the government to ensure that there is infrastructure for testing, for setting standards, for inspection, and all those things that need to be done by government in terms of building the capacities. And so currently we have a program also running in the country that's called MACUP. MACUP is a market upgrading program which looks at supporting various food supply chains to make sure that as the food is produced and supplied, that this food has been taken care of at every stage, so that the consumers are not then exposed to a situation that they will not otherwise themselves control.
Yes.
So government then has to buy, say, laboratory equipment, must train their inspectors, and they must then certify the products which go to the market. While the private sector, beginning with the farmers and the transporters and the retailers, make sure at every point they keep the standards. And once they are certified, then this food is then approved, and the government then watches as a just audits to see that the system is running.
Yeah.
This is what is missing food in Kenya, and we are trying to put in place a system.
Okay, and speaking of which, the government being the big brother who is watching, and we know when we go to the high-end restaurants, we then, on that door to the kitchen, no admission. We never know what happens behind there. In the kibanda, you go there, the food is already prepared, it's just being served to you. What is the government doing to ensure that they do maybe random spot checks, or just to ensure that the quality of the food that goes down our throats is of utmost standards, because we cannot get rid of the mama kibanda because of the economic status of the country, but also if you're also getting sick from the high end, then something needs to be done.
Yes, a lot of factors come into play in that situation. But most importantly, whenever you have to handle food, your health status must be clear. And within the law, you're required to have a medical certificate, a food handler certificate, which is prescribed and it renewed every 6 months. But that doesn't guarantee your health, because health is a dynamic situation. You may be healthy today, but in another 3 days you're suffering a cold or something. So in event of falling sick, it's important that any food handler has to go and get treatment. Now, when you say Mama Kibanda, you see, you find there is a challenge where this is her source of income. She may fall sick, seek treatment, not from a hospital, but just over-the-counter treatment, and go back to handle that food. So you find our health teams, it's a challenging area to monitor, because they may be here today and not sell there again the following day, because they tend to move sometimes from point to point. But what is very critical is whenever anybody handles food, in terms of trade, you must have at least a medical certificate to certify that you are healthy enough to handle it. Furthermore, whatever you do, make sure the environment is clean. Now, the county governments, I think they are making efforts to designate areas where food, we call it street vended foods, can be handled and prepared and sold to the public. Those facilities are important, and the designs, I think they must be consulting very closely with the Ministry of Health and National Office, so that anytime you go to a place, any town, any city within the country, you should know that if you want to get any street vended food, you'll get it in this area, and the facilities are provided: clean water, clean environment, good sanitation facilities, and the persons are also medically fit. Now, without an organized system of managing street vended foods, you'll have that challenge where you cannot guarantee that, as a government, you can't guarantee that, but it's the obligation of that Mama Mboga, as you call her. And on the same light, food handling, cabbages, sukuma wiki, you've seen what goes on. It's put in the open.
And you even ask the Mama Mboga to cut it for you. Yes.
Slice it for you.
Yeah.
Yet it's always important that the place where she's doing that business, it needs to be covered and not exposed to a lot of dust. Because this is food. And you may imagine I'm going to cook it anyway. But there are organisms which produce what we call toxins.
Yes.
You can't cook toxins out of food. They will always persist, and when you consume it will be very delicious, but at the end of the day you have a very situation where you have to spend time in the loo, driving a bus that you cannot control. So it comes, those are situations I'm sure most of us have had to experience,
dealt with, yeah.
and you wonder why. Yet it didn't seem like it was off order.
Okay.
That's the situation that arises when you handle food in an unsanitary condition.
Okay, now just an experience from Europe and how you handle. You rarely see Mama Mbogas, and we're talking about the small scale traders on the side of the road.
Still have.
Do you deal with
we
that?
still
How
have.
do you relate in to make sure that quality assurance is upheld?
We follow the same principles for small vendors or for big companies. The same principles. But of course there's different risk. If a big company produces a lot of food for a lot of people and they do it in the wrong way, there's a big risk. So of course we put more attention to where the big risks are. So that's the risk assessment. It's a very, very important part of our system, that you control where the biggest risks are. Because that will create huge problems if contaminated food reach hundreds of thousands of people. But the basic principles are the same, that we ask the food business operator to show us, the authorities, how they control and how they ensure that the food is safe, that they actually know how to cook in a hygienic way in the restaurant. So we would never put the blame on the authority, that they are the ones to ensure that the food is safety. That is the food business operator. So when you come to a restaurant, it's about how the inspector asks the questions and how he inspects, how she inspects. And the inspection will mainly be to put the questions to the owner. Show me how you ensure that everything is done in a hygienic way. So if something goes wrong in the restaurant and people get ill, you don't point the finger at the authority, but you point it at the restaurant owner. And if he cannot show how he's doing things in a proper way, we can close down the business. We can put administrative fines. And those instruments is very important to have, because then you know it hurts if you don't know the rules and the legislation and you cope with it, then we take action.
Okay.
And that's the small one, and it's also the big one. And the bigger fines.
The bigger the problems.
Yeah.
Okay, Dr. Lungaho, we are also dealing with something of, the presence of veterinary residues in our food. We're living at a time where one of the pillars of the Big Four agenda is food security, and we're trying to ensure that there's food in the market people can eat. But then again, we are going the way of ensuring that things are multiplied faster than usual. You know what I'm talking about, the antibiotics, the GMOs and what have you. And we are consuming all these things. But then again, people do not understand the importance of how much is too much. How is that being reeled in the Kenyan context?
I love the questions because they really drive the point that we need to do more. At the FAO, what we have realized is that we have to build capacity across the value chain. what you're discussing, many consumers don't know, or if they know, they don't have accurate information. As consumers, we don't know what information we should look for to guide us in choosing the right foods. So we build capacity. There's opportunity to build a capacity from the producers, the people who are using this veterinary supplies wrongly. We can build that. And by building that capacity, we allow people to do what he's exactly saying, take the responsibility to ensure that the food they produce is safe. And when we enforce then and measure to see if the residues are acceptable, then we'll be able to take their actions, like he says, to find them or even just publicize that what they're doing is wrong. I love what we're doing as a country in creating certification. For example, we have producers in Tharaka Nithi who have been trained on good agricultural practices, and they have a certification that they put on their packaging. So because as a consumer I'm educated on what to look for, when I go to buy my tomatoes, I look for their label because I know they're applying the right practices in producing what they produce. And I'd love for this information to become commonplace. How do we educate the common mwananchi on what to look for as quality? Even in developing countries, they simplify it. They give it a simple label that you can go and look for, so you don't have to read the entire story of how things were produced.
Yeah.
So if you can create a system that allows it to be easy for people to do the right thing and easy for the consumer to look for the right food for them, I think we can change the food system.
Okay, so the consumer can read and say, no, I will not consume this. I'll move on to the one that looks safe for me because it's been certified. But we do know that corruption lives in this country, and the person actually bringing the food to you could have bypassed the process. We're trying to also thrive in an environment where the climate change is working against us. So food is not growing at it should have, because the rains have failed us. So we've gone the greenhouse way. If it's the animals, we are helping them grow along so that we can be able to move on the chain. So what can be done on a Kenyan context for the producers especially to understand the damage they inflict down the chain?
I think first with regard to the residues of veterinary drugs, I'm sure Dr. Zegele will add something later on that. But this only constitutes one of the many problems that occur right at farm level. Residues of veterinary drugs, because you are treating animals and then you are told to wait by the veterinary officer on the ground. It says you don't milk or don't slaughter this animal until this number of days are passed. But we don't wait because money has taken precedence. So then we rush, we harvest our milk, our fish, and all those commodities that have been administered with veterinary drugs. Those are very dangerous. And so the remedy there, yes, including also for crops, you may spray your tomatoes, you may spray your cabbages against the insects. That was the purpose. But then this pesticide, the chemical that you are applying, while it was meant to kill the insect, you then harvest the crop, but it has residue of it there. And the same way it kills the insect, it has an effect on the human body. And this is some of the reasons why you have increased cancer cases in areas where people eat food which has been applied with so many chemicals. And so the solution at that level is to train farmers, to teach farmers, to make them aware that these dangers do occur, and show them how to do it, what we call in this jargon, good agriculture practices at the farm level. But then when it moves to the next level, other actors have got responsibilities. If you are buying from the farms, then you need to know which farm you are sourcing it from. And so within that domain of the business, then they also are going to ensure that the other problems beyond what happened at the farm is not again introduced. And this again should be done in the controlled environment of doing what we call good manufacturing practices and implementing standards which can then be certified again. So we certify the products that they meet those standards which have been set to to address those food safety concerns, because that's the easy way of doing it, to then get these products certified, then they are released. But even when they release the marketplace and you buy, it does not mean that it is safe if you have a label. And even if it was safe and you bought a very safe product and took it to your house, and as a consumer, you have a role to play, because some of them must be kept in the fridge.
Yes.
Some must be cooked before eating, because if you don't cook properly, then again you swallow the bacteria, which may have problems, and it could be hanging around there. Those who are storing, you find people mixing things in the fridge. Meat, milk is inside there, other stuff inside there, and it has cross-contamination. And all these things together require training. And the media in particular, with the interaction you have with the public, you have a big role to play. To educate, to have certain topics being addressed clearly, to inform the public that it's not that everything that comes and reaches their table, even if it had a label and the government had done their part, that it is now safe. They have a role to play.
Okay.
Thank you.
All right. Now, our role to play at this point is to ask the right questions.
Yes.
So, Dr. Allen, we know about a certain fast food restaurant that said it will no longer use antibiotics in its chicken, but it said this will not be this case in Kenya, and we're still seeing them in business. What does that mean?
Hey, it has far-reaching implications. But it's clear we wouldn't accept any product which has you've used antibiotics as growth promoters to get into our system. That is not accepted even in our laws. We do not allow for use of antibiotics as growth promoters. That is out. Now, more importantly, besides the challenge of having veterinary drug residues in food, we have also the other challenge of antimicrobial resistance coming up. Because when you use these drugs as growth promoters, they challenge the bacteria, you expose the bacteria more to these drugs, and they develop resistance. This is the same bacteria that is going to infect you. And when you go to hospital, the drug to be used to treat and contain that bacteria is the same one that was given to that animal. And therefore you find a lot of treatment failures, and you spend more time in hospital under treatment or using more expensive drugs. So the cost of healthcare becomes too high. And even putting to risk the universal healthcare program that we really are looking at. And on the other hand, you are also affecting the food security that we really should be looking out for. So use of antibiotics as growth promoters, that is out. And also farmers, we know the challenge that comes whenever you have administered a drug to say a group of laying chicken. Those eggs need to be destroyed. If it's milk, you need not put that milk into for sale. You need to pour it out. Now, there is a challenge, because as a farmer, you have a big milker here giving you almost, say, 30 liters on a daily basis. This is your source of income. It has fallen sick, you've treated, and you're told that milk has to be poured out. Now, think about it the other way. If you put it into the market, it will reach your son, your grandson, your brother, your sister. If you take it out of the system, you've saved all those relatives from harm at the expense of that, the costs. Because eventually, when there's a hospital bill, you see on WhatsApp, you have to contribute, and there could be 3 because of your action. So it's important that we recognize how important it is to observe the guidelines from the professionals. Whenever you are a producer of either eggs, milk, or any agricultural produce, the guidelines from the professional teams should be followed for the safety of the produce and also safety of yourself. and your relatives. It's not somebody else's who's going to suffer. It's yourself.
Yeah, the ripple effect is immense. Now, Henning, even as we finish this, you come from a part of the world where food preservation is, you know, number one. There's a lot of preservatives that goes into foods. Here in Kenya, mostly in Africa, we do a lot of fresh foods, but for some reason, it seems to have worked for you. But then again, it leaves a gap for food adulteration, yes, it is. So how is it that you ensure that you get the right food, but still ensure that no adulteration is done?
It's the same. It's back to the same point that I tried to make before, that it is the producer or the handler or the restaurant, the transporter that has to know how to handle and follow the law. So we make the law, and then it is their responsibility to understand and also translate the law into their circumstances. So we don't come and say, in your specific case, you have to do this and this ABC to follow the law and to avoid contamination or alteration and so on.
Yeah.
So it's their problem if they don't understand. Of course, you can have stakeholder engagement. We talked about it before. I think it's very important in Denmark. It's also very important in Kenya that the government is also playing a facilitating role of bringing stakeholders together. The private sector, the trade organizations, they come together. They understand that they have a responsibility. They also get better quality if they put the requirements down the chain. I mean, to their suppliers, we don't want this quality milk. We work in our strategic sector collaboration program on food safety. We work on two subsectors: the horticulture sector and the dairy sector. And we have showcased how important it is that county government, that the private stakeholder organizations, cooperatives, everybody that work in a certain area and a certain sector, that they agree on the way food should be handled, because it improves everybody in the chain. But it's also about money. You know, if I, as a producer, say I will not take your milk if it's not on this and this and this stand, I will not pay, or I will even pay less, or I will pay more for the good quality. Then it is easier to understand for the farmer, for example, that it gives more money in the pocket to provide good quality.
Okay.
It's a very clear message to send. I think.
All right.
Yeah.
So the consumer here is key. So if they are empowered, the ripple effect would definitely be what we want it to be. So even as we close, lady and gents, food safety, everyone's business, is a theme of this first World Food Safety Day. Your clarion call, Dr. Lungaho.
For me, as a mother, as a consumer, as a researcher, I see my different roles. I'm asking all consumers to look at it that way. One consumer can be a producer. They might be the farmer. Someone else might be the one who owns the supermarket. How do they bring food safety to the spotlight in every role that they play to ensure that all of us enjoy safe food?
And for you, Dr. Andrew?
3 key messages. 1, for the food business operators, it's the responsibility of every actor to make sure that within their domain, their scope of food, that the food is safe. Otherwise, it's punishable by law, and you don't want to go that way. To the government, I think there is all the tools that you need to make these things work, but there needs to be a coordinated approach where all institutions to carry out this food safety regulatory function to ensure that the public receives safe food. To the consumer, and this is also where the civil society comes in. They have a responsibility. You as consumers, you need to make sure that you know what you are eating. Eat safe food, and please seek for more information about the food that you eat. Seek on how it should be prepared. Seek on the risk that may be carried by that food. And for the civil society, it's important that we assist in this awareness creation. The media has a big role because interact with the public to convey clear messages about food safety, especially on this World Food Safety Day. Developing partners here, I must not forget the EU, having given support even for this program here, currently supporting Kenya on the making sure that the food supply chains, dairy, fish, fresh fruits and vegetables, all those are safe. And this is through a program called Agrify, and another one called Market Upgrading Program, Markup, under UNIDO and the GIZ. We will be so happy that we take advantage as a government of such development assistance to make sure that the money is utilized properly to improve food safety, especially in Kenya.
Okay.
Thank you very much.
All right, Dr. Allen, you're representing the big brother, and the buck stops, at your doorstep. Your clarion call.
The clarion call is, let's all come together and keep our food safe. It's not my responsibility alone. Big Brother wants all of you to come together and realize that food safety is all our business.
Henning, you are a partner, but definitely World Food Safety Day is not a Kenyan day, it's an universal day. Your clarion call.
I hope we can keep on assisting Kenya and have a very good collaboration on improving food safety here. And I think Kenya is moving towards a one line control unit in a food authority, and I think that is really the way to go, and I think that will improve this agenda we are talking about today.
Okay. Thank you, Lady and Henning, ladies and gentlemen. Henning Nyaga is what we're working with, the Royal Danish Embassy, Dr. Mercy Lungahao, Food and Agriculture Organization Representative, Dr. Andrea Dewa, United Nations Industrial Development Organization Representative, and Dr. Alan Azagere, who is from the Directorate of Veterinary Services. Thank you for your time, and definitely a good perspective of what the World Food Safety Day is. It is the first of its kind, but as we are saying, it is the first of very many others, and everyone within that chain is responsible for the food that you actually partake of. So let's take responsibility and live a healthier life.